Okay, welcome to this live webinar on WM and COVID-19 run by WMUK and Lymphoma Action. I'm Lindsey Bennister, I'm the Chief Executive of WMUK. So the webinar's come about because it's really a response to the concerns and the questions that have been raised within the WM community during this pandemic. So our experts are here today to hopefully give you some information, advice, and to use some tools for getting through this rather difficult situation. You can see on the slide a little bit about both of our organisations, and there will be information further on that will give you the links to finding out more information. So I'd like to move on to today's speakers and introduce you to the speakers and give them a minute to introduce themselves. So first off, over to Dr. Shirley to do a brief introduction.
Hello, good afternoon, everyone. I'm Shirley Dessar. I'm a haematologist at University College Hospital in London. And I'm really pleased that this webinar is going ahead with the help of Lymphoma Action. And hopefully we'll be able to answer questions as best as we can today, this afternoon, and provide you with some reassurance or guidance for the future.
Thanks, Shirley. Next over to Helen DeMarco.
Hello everyone, I'm Helen DeMarco. I'm a consultant clinical and health psychologist at UCLH NHS Foundation Trust, working in haematology across malignant and non-malignant haematology. And I'm really pleased to be here and have the opportunity to answer some of the questions and concerns people have about their mental health during this period of crisis.
Thanks, Helen. It's lovely to have you with us. And finally, over to Stephen Scowcroft. So Stephen's going to introduce himself, but I'm also going to ask Stephen to kick off the webinar subject with a brief summary of the current situation regarding COVID-19 at the moment in the UK. Over to you, Stephen.
Okay, thank you. I'm Stephen Scowcroft, the Director of Operations and External Affairs at Lymphoma Action, and it's really great that we're able to do this in collaboration with WMUK. And so, yes, as you are aware, it's now actually 12 weeks that since we've been locked down and that people have been shielding, and we know that it's been a really difficult time for people affected by lymphoma and obviously people with WM. Throughout that time, we've been really busy. I know both organisations have been busy updating our information. It's fair to say it's been a very cautious approach around COVID and particularly the impact of that on people affected by blood cancer and lymphomas being one of those identified as extremely clinically vulnerable. And so we've been working hard to keep our information up to date, deal with people's concerns and anxieties and queries and questions really around that. And so certainly at the beginning of that, we were doing a lot around clarifying not just about blood cancer, but about lymphomas and at different stages of treatment. So pleased that we were able to provide further information about that clarification. And that's something that certainly we'll be touching on a lot more today as well. Obviously, the start of that was about the letters, and we know that the current situation is that we understand that there'll be further communication around that in the next few days and weeks, certainly as that 12-week window has been and gone, and there are now slight variations in terms of the current thinking of when shielding will stop and what that means. But obviously also we're very conscious that new people being diagnosed with lymphoma and WM during COVID-19 as well, again, then becoming part of that shielding those challenges. So the general guidance and advice, there are variations throughout the different countries, but the main thing that the fact that that guidance is easing is the fact that, and the good positive news, that the incident rate is generally falling across across the UK. And we know that there have been people affected by lymphoma who've had COVID-19 and have recovered as well. So that's a positive position.
So as Stephen says, we're moving now on to the more clinical aspects of WM and COVID-19, and I'm delighted to invite Dr. Shirley Desar to talk to us about some of the key themes that we've identified. Now, the first theme that came up significantly in our questions of people had submitted was about risk in relation to WM and COVID-19, and here's a sort of a sample of some of the questions and themes that came up. So over to you, Shirley, to talk us through to do with risk and WM and COVID.
Thank you. So I suppose the starting point is that COVID-19 is a completely brand new virus. First time it's ever been in humans. And whilst we can apply principles that we know from how other viral infections affect us, it's a very fast changing situation. And when it impacts on people who already have health conditions, there are many variables there that need to be dealt with. In terms of risks, I think that is something that the government started off and has continued to a great extent to be very cautious. I think rightly so, because until we knew more about this condition, it was always preferable to err on the side of caution in terms of keeping away from the risk of actually contracting the virus. Coming on to WM specifically, though, I think one of the reasons we ourselves have had concerns about people with WM is because it is a disease of the immune system, and because COVID-19 has an impact on the immune system, triggers the immune system and a response. One of the questions was, does WM itself, just having the diagnosis, even if you've never had treatment, does that put you at greater risk of an adverse immune response, an inadequate immune response? And this is one of the reasons why the shielding advice was felt to be appropriate. I remember early on, I had patients who were on treatment, and that seemed fairly obvious to me. Look, we're actually immunosuppressing you now, or have done within the last few months. It seemed sensible to be careful and cautious. There were others who were on watch and wait, still working, otherwise extremely well. And it suddenly applied to everyone across the board. And I think I myself took a while to adjust my thoughts to this, because I had started off by thinking that perhaps people who hadn't got active progressive disease and need of treatment, perhaps they are safer and they have immune systems that are closer to normal. So I think the experience that has come out since the outbreak, has it taught us anything? I think it's hard to say. Certainly there have been people infected. There have been some unexpected results, in my view, or outcomes, where some patients who've had WM actively on treatment have actually contracted COVID, but haven't had any respiratory problems and have been fine with it. They've had other health problems, perhaps, that they were dealing with. Other patients have actually, who were out and about and well, have actually sadly succumbed to the disease. Now, the numbers are not great by any means, but this is my own experience in our centre in London, and also speaking to other colleagues around the UK. So it remains an unpredictable situation, and I think that's something we need to bear in mind. So it's still not possible 12 weeks on to say which subsets of WM patients are at greater risk than others. So I think that is a starting point, Lindsey, and I think we need to continue to gather information. The gathering of information has come through a number of ways. I mean, there has been feverish activity across the medical community globally, within the NHS, within all hospitals, to collect information, to measure who is responding, what the parameters are, which gives us clues as to what the risk factors are, what are the interventions that we can use to help limit the damage that COVID can cause. In terms of some of the other more specific questions, whether you are more likely to contract COVID-19 if you have WM, the honest answer is we don't necessarily think that is the case. It's in theory that might be the case, but as I say, people with other risk factors seem to be affected as well. People with high blood pressure, diabetes, obesity, people of an older age group. And one of the distinguishing factors between this coronavirus and other viruses that we've seen in the past and other pandemics and flus is that there seems to be an inflammation of the blood vessels, and that can lead to some unexpected findings such as blood clots, strokes, heart problems, circulatory problems in the peripheries that is more reminiscent of diseases like meningitis. And so that side of the condition has to be uncovered more carefully in the coming weeks and months. So I suppose my own view is that we still need to remain cautious all round, because prevention is better than no cure. We do not have a cure. We do not have an antidote for COVID yet. What has changed and is changing is the ways we can test for it, so that we can see who may have the disease, and that may help us to segregate people in different areas of hospitals or even perhaps daily life as we go forwards. But even those tests are still in the process of being optimized. There are some what are called false negatives and false positives that come through. People who have had very florid COVID-like symptoms have proved to be negative on testing. So the testing side of things is still evolving, and again, at the moment, medical people are not putting a huge amount of weight on that. I think we need a few more weeks for that to be a clearer picture as to who gets tested, what we do with the results, what it means for people, whether it means that you have developed some sort of immunity against future infection.
I think that's a really interesting point, Shirley, because I think the final question on this slide, if you've had COVID-19 and have WM, are you still classed as vulnerable and at high risk, even if you've had the virus itself? And I suppose the answer to that at the moment is we don't know yet at that point. I mean, if you had that scenario of a patient who had COVID, would you still recommend that they classify themselves as vulnerable and at high risk and therefore take the necessary shielding, or would you be a little bit more relaxed because they've had the disease, had the virus?
So I think the tendency to be a bit more relaxed is there, because that's the case with other infections. However, what I have seen in some cases is that the virus isn't cleared from the system, the respiratory tract. We've had some patients who've developed the virus and they've had repeated swabs spanning several weeks, and they still have it on their respiratory lining. And what does that mean? Well, it means that although they themselves are not badly affected at that time, because we've observed patients like this, it does mean that they could still shed the virus and pass it on to others. And, not an insignificant number of people have other vulnerable persons in their household. So I think as I say, it's really important, I think, to continue to take precautions to protect the individuals, but also the people that they live with and interact with. Because if you still one of the things we feel is that if people who've had immunosuppressive therapy, obviously the main concern is, does that put them at greater risk of severe infection and succumbing to the disease? But if, the second risk is, if they don't clear the virus, how do we manage them? They have to be sort of kept in isolation for a prolonged period of time, because they may be at risk of passing it on to other people. And that has been problematic in some households, because a patient may have a spouse who's elderly or vulnerable for other reasons, and depending on the sort of layout of the house, it's actually very difficult to segregate within a household, unless you have a massive sort of palace or something which has separate wings, which most of us don't have. So I think, these are real risks. And I think what the only way to do it is to individualize the advice as best as we can. So there's certainly no kind of one size fits all. One has to speak, I think, to the medical team looking after you, to describe your situation, and we would try and tailor the advice based on the individual's needs as best as possible. But equally, that advice is advice and guidance, as is the government's advice. In the end, if we followed absolutely everything to to 100% level, I think it would be very difficult, especially when you have to sustain it for such a long period of time, an open-ended way, and when it has such an impact on absolutely everything that you do in your life. Well, there has to be some sort of balance, but erring on the side of caution all the way.
Thank you. Yeah, so obviously one of those key things are, how do we continue to give treatment in the current environment? What have we learned up to so far? And as you said, testing is a really key important part of continuing to relax some of those restrictions a lot more. So Shirley, yes, there's a couple of questions that we've had in around access to treatment currently, and is some of the treatment that is actually for people affected by blood cancer, lymphomas, WM, actually effective with COVID-19 as well? There's been some further clinical trials into those experimentation. And then lastly, around the vaccine, and that will help to kind of ease. So what's your experience in that?
Well, first of all, I guess if we think about the treatment of WM in people who need it, there have been some modifications for sure since the pandemic started, based on this concern about immunosuppression. There were two aspects to it. One was the fact that if you have someone who is immunosuppressed, it's undesirable for them to come up and down to the hospital on a regular basis to receive that treatment, because then they are removed from a shielded situation, unless there is a sort of virus-proof way of getting to the hospital and back. In the early days, there really wasn't that. Now it depends on the hospital where you're at, but there are, in many centres, there are transport arrangements available, provided by ambulances or cars that are specially cleaned between patients, and masks and all the precautions used. So there was the practical aspect of actually coming up to the hospital to get treatments. So for many patients, that was actually curtailed, and in some cases, treatments were converted to oral therapies. I believe that a number of people who were on chemotherapy treatments were converted to ibrutinib, for example, perhaps earlier than they might have been, because ibrutinib is an oral agent and you can take it at home. There was also early on some discussion about whether ibrutinib might actually be protective against the virus. And the jury is still out on that, to be honest. There are trials underway because ibrutinib is an immunomodulatory drug, and it might have a property that minimizes or somewhat neutralizes the very florid so-called cytokine storm that some people have in response to the virus. And that's the rationale for the trial. But I would say that we don't know yet whether ibrutinib is truly protective. So if you're on ibrutinib, it doesn't mean that you can skip the shielding, for example. The other thing, of course, with the immune system and discontinuing therapies is that the immune system doesn't bounce back within days or weeks. It usually takes months and perhaps a year or two after rituximab-containing therapy for antibody treatment, for production to improve and get back to normal. So some of these changes we made were a sort of a limiting type of approach, but they wouldn't immediately mean that people are out of the woods in terms of risk. So treatments have been altered. I think to a large extent, everyone has tried to make sensible decisions, pragmatic decisions, and certainly those who really need treatment for clinical reasons have gone ahead. People who are in the midst of treatment that was deemed to be important to continue have continued. And the good thing is that most hospitals do now have much more robust mechanisms for us to look after those patients with COVID-free zones, swabs when you come up to the hospital in advance, and so forth. So I think in terms of when and how that will get back on track, I think we still don't yet know. But I would say that people who need treatment are getting it. Now, there are some cases where they probably would have started treatment, but we're waiting a few months because we have taken a view, looking at the patient and how they are, that a few more months will be acceptable. This is something one has to look at very, very closely and regularly to make sure that the person is not disadvantaged by a perceived risk, and they may have a disease that needs treating sooner rather than later. So it's a balancing exercise for each patient, which has to be done individually, really. In terms of the kind of treatments available for COVID, there are a number of trials ongoing at this moment. I have never come across such speed of launching trials that I've seen in recent months. It's been absolutely breathtaking. And it does suggest that actually we can overcome some of the bureaucracies we otherwise face. That might be, if that's a good outcome, I'll be very pleased about that. But people have really jumped up, and the authorities as well have really enabled trials to get through as quickly as possible. Again, it's early days to say what those trials will show. As you know, there was an announcement yesterday about dexamethasone, which is an age-old steroid preparation that many of us use very regularly in our patients. I think the thing to remember about the dexamethasone results is that it does appear to be effective in people who are already critically ill. It's not something that we recommend in people who are out and about, even if they have mild symptoms of COVID, because steroids do have a sting in the tail. They do immunosuppress people, and they have other factors that can cause problems. So there are patients, not so many, some people with WM have dexamethasone, but there are other diseases which are regularly treated with dexamethasone. And we certainly would say, don't, if you have them at home, don't just sort of self-medicate in the hope that you'll be, given some extra protection. So that's one thing. And the other thing is that, what is reported in the press is often an attempt to try and prove that progress has been made. And I think one has to be a little bit careful in interpreting the words, because there are always caveats in medical scenarios. Nothing is as straightforward as it seems, because it isn't. There are lots of different aspects that need to be taken into account. And I think what really counts is a proper assessment of trial outcomes, which is peer-reviewed. And I think we need to be, before these things are just rolled out, I think it's important for us to take a very careful view. And believe me, that is happening across the board, amidst all hospitals and academic centres and everywhere, really. So that is underway. There are a number of other agents being tested in many hospitals across the UK, treatments that are used for other hematological and other diseases, which again, like ibrutinib, might well calm the immune system down and the response to the virus. But they're literally in progress at the moment. So I hope we do see some benefits from these trials.
I was just going to pick up on that final question on the slide about whether you would be supportive of people with WM volunteering for COVID-19 clinical trials. Is there any reason why you think people shouldn't?
No. So what would happen is these are basically trials taking place in hospitals. So each trial, and there are about 4 or 5 of them, they have their own unique inclusion and exclusion criteria, like any trial. And so the teams that are running the trials will actually check very carefully whether anyone who contracts COVID and is in hospital is eligible for one of these trials. And if so, they would be offered. And I would say, if you have WM, I wouldn't use that as a concern to not enter the trial, because none of the trial treatments would, in my opinion, specifically impact negatively on WM. And of course, clashing with any medication that you might be on will be looked at very, very carefully. So if you are offered a trial, it will be based on some very sound principles. But you know, at the end of the day, you can always seek advice from your clinician, whoever looks after you generally, or ask your doctors, whoever's looking after you acutely, to consult with your consultant to make sure. It depends where it all takes place, of course. But in principle, no, I think it's fine for people to volunteer for the COVID-19 medication trials. I mean, at the moment, the vaccines are being tested in volunteers rather than patients, because it's that stage of the process. So at the moment, vaccines are not available for patients, but before they are, I think there will have to be a further step of consideration of what the impact might be on different individuals, depending on what their immune systems are like. So I think that's a little way off. But again, I have to say that development of these vaccines has been much quicker than many of us thought, which is very promising. But I think we do need to wait until there is a substantial amount of evidence before it is rolled out further.
Thank you. No, I was just going to say, can we cover that aspect of vaccines? But again, obviously we would want the vaccine to be able to be effective for people affected by lymphoma and WM, and the only way that we can do that is, as you said, you know, cautiously move forward in terms of using what evidence is available in order to get to that position. But that's not going to be in the short term. That's a long-term approach. We talked a bit more around the kind of moving out of shielding, but so as you said at the beginning, the purpose of shielding really was, you know, at the very beginning in the UK, it was around staying safe, protecting the NHS, and particularly people who'd been extremely clinically vulnerable, and that's been a challenge, and we know that that's been difficult for people, but that's starting to relax a little because we understand that the incident rate is falling, but obviously people are concerned around that. So, you know, is it safe to follow the government's latest advice, and how come it's now is the time that people are able to go out for exercise or potentially to meet other people outside, but with social distancing as well?
Mm-hmm. Yeah, that is a tricky one. I think the medical fraternity was a little bit taken aback when the announcement was made that people could start going out. Obviously consultation had happened with various persons, of course, who are no doubt medical and so forth. But what I've said to people is that, in fact, in terms of any active measures, we haven't got anything new to offer someone who becomes infected with COVID. So there is no treatment or antidote at the moment. My feeling, therefore, and I think many of my colleagues, is that continued caution should be exercised in regards to shielding. This may seem a real blow for many people, because isolation is a very depressing thing, especially when you can't see family members or do other things, you know. What I've also said to people that, you know, we have to be somewhat pragmatic as well, because it's a balance between protecting yourself against severe ill health, but also managing yourself mentally, psychologically, and trying to get a balance so that you don't sort of remain physically fine, but mentally sort of crack up, because that's not going to be very helpful either. So I think it does depend on people's circumstances. There are some patients I've spoken to who are fortunate to live in areas where they can step out of their gardens and walk along quiet areas and lanes where they do not come across people. And I think that, to be honest, is fine, because it's really about keeping away from others. So if you can do that, then I think you should. But that also means, you know, what about families? Can they then come to visit? I think, again, if you can meet someone outside but keep that 2-meter distance, that is probably allowable. But again, I'm being very cagey here with my advice, because I don't really have anything to base that on. But I think from what people have looked at in terms of distances and spread of droplets and so on. If you were to meet family who were fit, as far as you can tell, and they have reported no symptoms, if you were outside, if you were to wear masks, if you were to exercise caution with hand washing and so forth, and really not handle each other or each other's belongings. I think I think to some extent, keeping all those things in mind, you may be able to meet along with people, but not indoors and not hugging, not touching, and just being extremely scrupulous about hand washing and disinfecting. But in general, I mean, for those who don't have that opportunity, I think shielding is the safest until we know more. And it may be that within the next 4 to 6 weeks, we'll have further developments, maybe testing will be at that level where we can say more firmly, look, so-and-so has antibodies, therefore they are unlikely to be infective, or you may be able to have a quick swab that tells us that someone's not shedding the virus. But I hope I don't want to send a confusing message out there, but I think shielding is best still, in spite of what the government has said, in my opinion, and I think in many of my colleagues' opinions. I think that individuals at the end of the day will need to make their own choices. They can speak to their medical teams about their specific circumstances. I know some people have opted for a sort of a safe but slightly more relaxed thing, because it's just the way it can help them to cope with the situation.
That's really helpful. And I mean, I think one of the questions on that slide is interesting as well, from somebody who may be following all of those shielding guidelines, but have got members of their household now going out and about, and obviously taking a bigger part in society now that lockdown is easing. How do those people, do you think, deal with maintaining that sort of the shielding and protecting themselves? Because obviously they don't want to limit the people in there or restrict the people in their household from going out. Have you got any advice you could offer there?
Well, yes, I mean, I think, again, so what I have advised people about children and going back to school is to perhaps defer until September, if at all possible. This is quite a big ask, especially for children who perhaps could go back. It again depends on the circumstances of the household. I think that when children go back to school, of course, they will, I know there are distancing measures being placed in schools, etc., but they will come into contact with others, exponentially compared to what's been happening in the recent shielding time. And I think that it has to be an individual decision, but in general, given that the summer term has very little left to go, especially with the younger kids who will struggle to really distance and keep, they may have a limited understanding of what's possible and what isn't. The chance of contracting, picking it up, even with the precautions taken by schools, etc., is there, because people can transmit the virus without having any symptoms whatsoever. So that has been my general advice. It's been altered in some cases depending on specific circumstances. In terms of people who go back to work with a vulnerable person in the house, again, I think the world can't grind to a halt for families, and I think the next best thing is for measures to be taken mask wearing when at work. We need also for people to understand how to wear masks so that they don't put it on and then touch it and contaminate it. So I think guidance about how to put a mask on, take it off, which is available, I think, on a number of websites, to be honest. I think that's very important. That should help to limit the risks. And things like coming home and basically going into a little quarantine area, just taking off the clothes that you've been wearing, straight into the washing machine, and then changing or bathing. I mean, it sounds quite draconian, but I think that's the way of trying to make things as safe as possible, something that's within the power of individual families when many other things are not. So I think, again, some people's circumstances are such that they can't simply work from home. They have to go back. I think in these circumstances, perhaps the next best thing is to take every measure you can to sterilize the individual who's gone out upon their return to the home. And you know, hand washing is actually crucial because the viral coat has what are called lipid molecules in it, fat molecules, which like any sort of fat, when we're in the kitchen, you use soap to wash pans and so on. Using hand washing with soap actually destroys the virus by releasing all the genetic material. So it sounds simple and basic, but little measures like that, I think, are really important and not to be, you know, considered unimportant. I think they're really crucial.
We had a lot of questions around the psychological aspects of the impact of COVID and coping through this pandemic. And, you know, a lot of the themes were around sort of the acceptance of change or coming to terms with change, a new normal, fear and anxiety, and how to cope with all of this. So, you know, from your expertise, perhaps you could give us a little bit of guidance about how people could cope with these very difficult circumstances.
Well, as we all know, COVID-19's really had a big impact on the way that we all live our lives. It's disrupted lots of our routines, it's reshaping our lives, and there's been a real sense of collective fear and heightened vulnerability, really, and risk. And initially, it was that everybody was largely doing the same thing. There were some people who were seen as being more at risk of getting the infection, but generally people were sort of, lockdown happened, everybody was kind of doing the same thing, and there was a very rapid need for change. And humans are creatures of habit. We can struggle with change, and change in itself can be a source of anxiety. And the way that we usually adapt to that is we take time to process it, we gather information, we help ourselves to manage around the uncertainty. Of course, that's been really difficult with COVID-19 because it's all happened so quickly, there's so many unknowns. And so I think one of the things to recognise is that the sense of crisis can be in itself really wearing, really tiring. It can really wear people down. And so one of the things I would say that it's really important for people to do is kind of limit their digital diet, if you like, to try not to watch every bit of information, every TV show, all of your conversations on social media to be around COVID-19, because that'll help you to hold on to a sense that this will pass, times will begin to get back to normal, and hold on to a more hopeful future. And that's really important for helping us to adjust and adapt. So a time of adversity, we all know about post-traumatic stress disorder, but often people don't know about post-traumatic growth. And a time of adversity can also be an opportunity for learning and growth. And that most people actually will bounce back from this without needing formal help or any additional extra support. They can manage it on their own. We have resilience as human beings. But it's really important to know that our state of mind really influences how we experience the world. It's our lens through which we experience the world. And so if it will influence, the way we think will influence the way we respond. And so what I'd say to people is give yourself time, give yourself permission to feel what you're feeling, but also think about adopting a kind of coping mindset. So remind yourself how you've navigated changes in the past, how you've overcome difficulties before. Reset your expectations, not only of what life might be like, what you can expect from other people, but also what to expect from yourself. You're not going to be able to do everything in the way and as perfectly as you could do it before COVID-19. But it's also really important to hold on to some routines and boundaries, and to keep in mind the strengths and resources that you have. Then take steps, as Shirley was saying, to kind of regain some control in a situation which feels beyond our control. Actually, there are things that we can do to re-establish some control. Instead of just focusing on what you can't do, begin to think about what you can do, what is within your control. Engage with things you enjoy doing, maybe try new things, experiment with new ways of coping, and really, really important, reach out to other people. Don't hold on to this struggle on your own. For people who have been recognised to be a particular risk, they've got the additional problem now of adjusting to a relax in an easing of the restrictions, and that in itself is yet another set of demands. So how do you feel safe when people have said that you're at increased risk? And how do you manage that worry and increased vigilance? Well, I think it's as Shirley said, it's about managing that risk. It's about taking prudent precautions. It's about doing what you can do. It's about recognising that there is a risk, but doing what you can to manage that risk. It's about normalising your feelings. It's okay. Everybody is kind of feeling more anxious, more stressed at this time. And it's about also taking time away from that worrying. One of the things that can happen when our thoughts get more noisy is that our focus can shrink. And when our focus shrinks, then we stop maybe seeing things in quite the same perspective. And it's really important in terms of managing an anxious time like this and difficult worries to kind of keep your worries in perspective. So maybe think about taking a step back, putting a bit of distance between you and your worries. How do you do that? It takes a bit of work. So instead of getting caught up by our thoughts and our worries, kind of try to adopt a position of being an interested observer, noticing what you're thinking, but noticing it without judgment, trying not to slip into a situation of sort of self-criticism or denial, but instead kind of being kindly accepting and gentle and compassionate to yourself about how you're struggling. It's normal to struggle in these abnormal times. And then there's something about managing the physiological effects of stress and anxiety as well. And that when we feel like that, our bodies kind of automatically respond by a fight, flight, freeze response. And so it's thinking about what can we do to help settle ourselves physiologically as well. And so that's things like breathing, relaxation, mindfulness, meditation, all of those things can really help. And then in terms of thinking about how do I begin to take steps forward back to a more normal life? Well, it's about starting small, taking it step by step, thinking about what else might I put in place that might help me feel safer about this, about taking these steps. So I think it is about sort of recognizing that your feelings are quite normal and reasonable, but also thinking about how can you put a bit of distance between them so that your actions are more based on sort of thoughtful thoughts rather than a flood of emotional thinking and anxious thoughts.
That's really interesting, Helen. And I think one of the positives that have come out of some of the recommendations of techniques that you can use, the positive from the lockdown is that there's much more available online and virtually in terms of things like mindfulness and yoga sessions online.
Yeah.
It is a massive help, I think, in terms of if you are in your house and not able to go out and take part in things outside. So
yeah, absolutely. And I'm very happy to do is also provide you with some of those resources so that people can also find ways that they can connect and use some of those real coping strategies. And I think a lot of them really translate very well to online services as well.
Yes, and that's something that, again, as WMUK and Lymphoma Action, we can have those on our websites, and we've got a lot of information more generally around living with and beyond lymphoma and obviously we're able to support some people through our helpline or through online support groups. We've both got Facebook groups as well. So there are resources available through us as organisations. And also, Helen, maybe as part of those resources, there's perhaps, if people really do need to connect to more services, then there are ways that they can do that through their local hospital or their GP or whatever.
And, you know, UCLH is a good example of this. UCLH, we are still operating a full psychology and counselling service, a full complementary therapy service, and that it's important to either talk with your specialist healthcare team or your GP if you're really needing help.
So just before we come to the end of the psychological side of things, is there anything else that you would advise people to do?
So I guess, I guess the other issue that people brought up was around talking with children, around supporting children, and children have had it really hard. You know, there's been homeschooling children, and parents have really struggled with the demands of homeschooling, and that young children particularly find it difficult to understand. And how, when you're struggling, might you support your young child around this? And I think the thing that I would say is, first of all, make sure you get some support and some help for yourself, because you to support your child, you're really going to need to be in a position where you can sort of talk calmly and patiently through it. When you've done that, then I think it is about talking in an age appropriate way, working out what your child might need, being patient and open, consistent, having a number of different conversations, listening to their concerns, allowing them to ask questions, giving them time, and maybe also using other techniques as well rather than just talking. So sometimes play can be a really useful way for parents to help children in terms of exploring worries. There are some books out there that are freely available. I know Axel Scheffer of the Gruffalo has created a free book around coronavirus, and it's about also helping make sure that there's some sort of routine and contact for children is supported, so to help them better manage the anxiety and the changes of the time.
We've just got a few minutes left, and I was just going to put one point out there to perhaps Helen and Shirley that you could consider. You know, we're in a position at the moment where there may be changes coming up, whether it's with shielding changes, whether it's social distancing being reduced, and that's going to be a whole set of new challenges and changes for people. I'd like to know, Shirley, perhaps from you, second, what you feel about those changes, those potential changes in social distancing. But Helen, I just wondered if you feel, this is just another part of coping with the significant changes that are going on, and that it's very much about using those techniques that you've talked us through.
Yeah, I mean, I think that so there are a few different things that really make a difference to how people manage change. And one of the really important things that makes a difference to how people manage change is their connection with others. So what I would say is it's really important you might not be able to connect and maintain your relationships with people in the same way that you could before the COVID-19 situation, but seek out ways that you keep connected with people or develop new connections, so online or over the telephone. And the important thing is that it's not just isolation that's difficult for people, that impacts people's health and well-being. It's their perception of isolation. So it's not just the number of contacts you have, it's about how you feel, how connected you feel. And so that is something that people can really make a difference to, really strive to connect with online communities, with friends and so forth. And I think that all of those things will make social distancing more manageable. Relationships won't seem the same, but they will provide a different possibility in terms of having some social contact, and times will get back to normal.
Thanks, Helen. And Shirley, just a final point from you. We know that there may be changes ahead, and how do you think, from a clinical perspective, patients should deal with that? I mean, we've heard very much from you that it's about people looking at their individual risk and discussing with their clinicians and healthcare teams. I presume as rules and regulations change, you would continue to give that advice.
Yeah, I think we all need to keep an eye on news and guidance as it comes out. I know we at WMUK and I know Lymphoma Action are doing this, keeping an eye on it, trying to make sense of it and make it available for people to look at. Because there is, as Helen says, there's too much information out there and it can be very overwhelming. So I think choosing carefully, to try and follow the story as to how guidance is evolving. I think there is talk about 1 meter being adequate instead of 2 meters. I don't think anyone really knows, because the people it's different categories of specialists provide this advice based on different models. It's, at the end of the day, it's all a degree of generalization. But I think another important point, which I didn't manage to make earlier, was that in spite of everything that's been happening, Helen reminded me by saying, reach out to others. Don't forget to reach out to the NHS if you're not well for any reason. I know that the early message was stay away, stay indoors, just ring 111 and all the rest of it. But seriously, the NHS is functioning. It's functioned throughout. It was obviously under huge pressures a couple of months ago, but things are opening up and it is there for you. We can cope, we can manage. It's really important not to neglect health issues as they come up, whether or not they're related to WM, because at the end of the day, if there is a neglect of those things, then we end up being more disadvantaged, behind the curve, medically speaking. And so I plead to everyone, if you have a concern, please reach out, report to your doctors. There are ways of doing that now. There's been a lot of evolution about how to get in touch. But that is also very, very important. Make sure that you do seek help, because it is available there.
That's a really great message to finish on. So thank you very much to Helen and Shirley as speakers, and thanks to my co-host Stephen. And just on the screen there is just the details of both WMUK and Lymphoma Action's contacts, where you can go for further support. And just a reminder that we have lots more information on our website, and this recording will go up there, and we're also hoping to do a few more recordings later on of some of the questions that you've asked that we've not been able to cover today. So we will let you know once everything is up there on our website in the next few weeks. And hopefully we may be able to do some more of these webinars into the future. And just finally to say thank you very much for joining us, and we will speak to you all again very soon. Thank you.
Thank you.
Thank you.
Thank you all. Bye-bye.